Hello everyone, I am Dr. Keerthi, fertility expert, Ferty9 Hospital, Vizag branch. In this video, I am going to explain you about blocked fallopian tubes. Usually so many patients are asking like, Madam, I have blockage in the tubes. Can I conceive or not? So the short answer for this question is yes. You can conceive with blocked fallopian tubes. So I will explain how you can conceive. So the first thing is there are two fallopian tubes, like right and left fallopian tubes in our body. So what does these fallopian tubes will do? Usually in every month, egg will be released from the ovary, and these egg will enter into the fallopian tubes. And during intercourse, the sperms will enter into the uterus and then into the fallopian tubes. Those fallopian tubes are the site of fertilization. So the main thing what you have to remember is the fallopian tubes are the site of fertilization. So because of some of the causes like infections. So in our country, tuberculosis is the major cause of the tubal blockage. So what are the other causes for tubal blockage? So one is the pelvic inflammatory diseases. So in these pelvic inflammatory diseases like tuberculosis, because of the inflammation the tubes will swollen like that, and there is complete blockage of the both the tubes. Then endometriosis. So in endometriosis patients, what will happen is usually tubo-ovarian anatomy will be disturbed. Usually the egg should enter into the fallopian tube after it is getting released from the ovary. But in these patients, endometriosis patients, there will be adhesions between the ovary, tubes and uterus. So because of these adhesions, what will happen? The egg which is released, it is not able to enter into the fallopian tube. There are some patients like tubectomized patients. So those at some point of their time, they don't want children. So they will undergo this surgery called tubectomy. And after some time, they'll again want to have the children. So all these are the causes for the tubal blockage. Then how we can recognize these tubal blockage? So only one very simple test is the HSG or SSG. So that is hysterosalpingography. So in this test what we will do? We will inject a dye into the uterus. So this dye will enter from the vagina to the uterus and the fallopian tubes and into the peritoneal cavity. So and we will take an X-ray. So with this simple test we are able to recognize the tubal blockage. Then what are the treatments available for this tubal blockage? So first thing is in some selected cases we can do hysteroscopic cannulation. So with the help of the hysteroscopy, we are able to enter into the fallopian tubes and we can release those filmy adhesions. But in majority of the cases, the only one treatment which is available and which is successful for the tubal blockage problem is IVF, that is in vitro fertilization. So in IVF what we will do? Usually from day 2 to, that means from second of the menstrual cycle, from day 2 to day 10 we will give the injections. Then after 10th day usually we will retrieve the eggs. Then we will form the embryos. So these embryos will be injected into the uterine cavity by a process called embryo transfer. So with the help of the embryo transfer, we are in IVF, we are directly able to enter into the uterine cavity without any help of the fallopian tubes. So by all this discussion, what I am going to say is, the patients who are mainly tubectomized patients or tubal blockage patients, there is a technology called IVF. So with this technology, you can able to conceive even if you have a tubal blockage. Thank you so much.